There are many ways I think you can help. The first thing, probably you can start a wiki page today and then put up all the things that we've been talking about, this health rights and all the information in one page so that everyone can access it. That's probably one thing where you can start, because Dr. Nastu has to run like, all over the valley to get those information put together for a presentation. Why not put that in one place and start a wiki page everyone can edit, and maybe you can have your legal experts to edit it later. That you can start doing that. And the other thing is maybe you can help with the new information recording system. This medical recording system that I'm trying to implement in Ampippal Hospital from next year. This is an open hospital software. It's an open source project, and we are hoping to extend it. And maybe some of you, if you are IT professionals, maybe you can help with it. I've been in touch with this Alejandro, or I don't know his name is. He's an Italian guy who is the lead developer of the product. And also the German team, I've asked them to train our staffs there. So I'm having one of the IT teachers going there and staying there for 15 days a month and teaching our staff to use that software. So by next year, when the new OPD runs, I want to run that this software as well, and I want to extend its capability. I want the patient to come and then put their thumb, and with this biometric, I want to pull up their data. And I also want to put it up on some kind of secure server. So we may not have all the know-how, and also we need to save those data in many different places so that it would be secure. So if they're interested, volunteer IT professionals, then you can stay in touch with me. We can work things out. Also, there are other apps being developed right now. Also, one is developed by Dulikhel, I don't know, or maybe NREN, for this pregnant women, and how to deliver this information in local language and other things. Those kind of apps you can start working. It's most of the people live in rural areas, and 60% of us are only literate, 40% are illiterate, and then out of that 60%, I don't know, maybe 6% would speak English. And we are a country with 110 different living languages. If you go by the last census, it's a living museum, 110 different living scripted languages. So you can localize those information. You can work on apps and to localize those information. You can have visual these animations that can be put on the website or maybe on the app that can be delivered to this. Let's say, for example, a pregnant woman comes to the hospital. Maybe she has a smartphone, Samsung or something, low-end smartphone. You can put that video or animation there, and that would teach her what kind of changes she's going to see. Those kind of educational apps that you can make. Just spread around the positive stories. You can be negative about many things if you choose to, but you can surmount it. I mean, there are so many things I've improvised there. So many things. I have supervised 23 students from there, and 4 GP residents. 2 of them are working now as full-fledged GP. One is in Pasteur and one is in Darsula. And 23, and of this 23 students, about 12 of them are graduating this year. And some of them have, expressed their desire that they want to be a GP and want to work in a rural place like me or something like that. And that was the proudest moment for me, that I could do something and that influence these younger people, Right this moment when we are talking about all these things, a man might be dying in Jumla. He might just be 36 and he might be dying, and we can't do anything to prevent his death. And maybe another guy is also dying here in Kathmandu, and we can't do anything about that death either. But the problem is that guy who is dying in Jumla at 36, his counterpart in Kathmandu will live into 70s. Do you understand what I mean? If two guys were born, one in Jumla and in Kathmandu 36 years ago, that guy would die today. And the guy that is born in Kathmandu will live 36 years more. What wrong did he do? That he popped out in the wrong side of the mountain? That he's not in the valley and he's in Jumla? That's the question we should be asking ourselves. You can make infographics and take it out to the schools. If whatever schools you are going, you can talk to your friends. You can talk to your to the classrooms, and you talk about those things. You can put together this health rights, all this information into one infographic that Sumana was showing me yesterday. Make it more local with the pictures and everything. You can start distributing it, you know. And if you have connection to the local FMs, go talk to them and spread the message, spread the word around, you know. There's one local FM there, and I sometimes go and talk to them. I haven't done that for quite some time now, though. And I spread the word, you know. That's start small. Don't be too ambitious. The main thing is sustainability, you know. When like 50 people gather together and then we talk big and the enthusiasm runs high to the ceiling, and the moment we get out and it just falls flat. And don't do that, you know. To work to make change happen, we have to work it for a long run, you know. It doesn't come overnight. And save your energy, save your stamina, pick your battles, they say. You can't win everything, and just, you know, you win some, you lose some. If you want to win a war, you just have to pick the correct battles. All right? So start small, make it sustainable, and start talking.